I am Marcy Long, and I'm the TriageLogic nurse educator. Telephone triage nurses use protocols when assessing their patients. This helps assure that the information they are providing is standardized and that patients are receiving the most appropriate care. This short video gives you an introduction to what protocols are and how they are used by the nurse.
During this video course, we will explore a brief history of telephone triage, how it works, what protocols are, and how they are used to determine a safe and appropriate level of care for each caller. Let's start by answering a few questions to see your current understanding of nurse triage. Write down your answers to the following questions, and at the end of this video, look at the questions again and compare your answers to your newly learned knowledge.
So what exactly does the word triage mean? The term triage comes from the French verb trier, meaning to separate, sift, or select. In times when supplies or other resources were insufficient, such as wartime, determining which patients required immediate attention or medication and which patients could wait was common practice. Triage was also used in determining the order and priority of emergency treatment, the order and priority of emergency transport, or the transport destination for that patient. The term triage is thought to have originated around the 1800s and was further used during World War I by doctors treating the wounded soldiers. Those responsible for the removal of the wounded from the battlefield or their care afterwards would divide the victims into three categories: those who were likely to live regardless of what care they received, those who were likely to die regardless of what care they received, and those for whom immediate care might make a positive difference in their outcome. A similar model is still used today when rescue personnel are responding to disasters such as volcanic eruptions, mass shootings, earthquakes, and rail accidents, or when emergency room census is extremely high. Let's go over some other ways that triage is used today. It is also used in non-disaster incidences. It is used in physician offices to determine which patients need immediate care. Nurses working in hospitals use a triage system to organize their patient load. And triage is also used in nurse call centers to assess their callers and determine safe levels of care. Let's go back 40-plus years to learn the roots of telephone triage. Since the 1960s, nurses have been using the telephone as a convenient tool for managing patient care. However, it wasn't until the mid-1980s that computerized guidelines and documentation tools became available. It was during these years that there was a drastic increase in the number of nurse triage call centers around the country. Nurse triage, despite being a relatively new field in nursing, has evolved dramatically, just like every other aspect of medicine. Over the last 10 years, as internet use has become more widespread and nurses were able to access computer systems remotely, we began seeing triage nurses move from call centers to working from home. There were several challenges to overcome in order to safely move agents to a home setting. These included how to maintain HIPAA compliance, how to supervise a staff that all worked from home, and assuring quality control, including the recording of all calls. With the advancement of technology, many of these hurdles have been overcome. Today, the advanced nurse triage platforms are completely web-based. They're scalable to accommodate the needs of the smallest physician practice to the largest hospitals, and have several advanced features including integrated call recordings and the ability to transmit each encounter directly to the practices via fax or directly to the patient's electronic medical records. So what exactly are protocols and how do they work? Protocols are specialized algorithms that are used to evaluate the seriousness of a caller's condition based on their present complaint and their answers to a series of questions starting with the highest acuity, 911, and working down to those symptoms that can safely be managed at home. Because of the variety of ages and multitude of reasons the patient is calling, the triage protocols have to be extremely comprehensive and need to give targeted advice based on the symptoms and disposition of the caller. Protocols, like the nurse's stethoscope, are just one of many tools used by the triage nurse to assess her patient. The nurse must also rely on her past nursing experience, her judgment, and her critical thinking skills. This advice is targeted and specific based on the patient's symptoms and the disposition that was chosen. Protocols can also allow the nurse to recommend home remedies, make an appointment, or refer to a specialist or an urgent care facility as appropriate. The most important thing that protocols do, when used correctly, is ensure that consistent and accurate advice is given to all patients that are calling about their health concerns or symptoms. There are different types of protocols used by nurses and other healthcare professionals today. Some protocols are used for workers' compensation clients, others are streamlined to adults or pediatric patients, and yet others are used for psychiatric patients or OB/GYN. Most protocols used today are symptom-based, meaning that the patient will call with a symptom, such as vomiting or a headache, and the nurse will use the corresponding protocol to assess the severity of the patient's symptoms. We will focus on the Schmidt-Thompson protocols because they are the most widely used in modern call centers in electronic format. Let's start with a brief introduction to the doctors. Dr. Barton Schmidt is Professor of Pediatrics at the University of Colorado School of Medicine. He has written more than 100 articles for fellow pediatricians, as well as the book Pediatric Telephone Protocols and the computer software program called the Pediatric Advisor, which is used in over 450 hospitals nationwide. Dr. Schmidt has received numerous awards for his work, including the American Academy of Pediatrics Education Award in 2004. Dr. David Thompson is board certified in emergency medicine and internal medicine with over 25 years of experience. He is the author of 3 integrated sets of clinical content for use in software and numerous medical articles. He lectures in areas of telephone triage, professional coding, quality improvement, and patient satisfaction. An important aspect of the Schmidt-Thompson telephone protocols are that they are an example of symptom-based protocols. The goal of these protocols is not to diagnose the patient, as that would be outside the scope of nursing. Instead, their purpose is to assess the patient's symptoms and direct them to the right level of care required based on the severity of their current symptoms. These protocols are comprehensive in the sense that no matter what specialty or primary care doctor the patient sees, when used correctly by the triage nurse, these protocols cover over 99% of all symptoms. So they are thorough enough that the triage nurse will almost always have a guideline that will apply to her patient's situation. Schmidt-Thompson protocols are thoroughly reviewed by a panel consisting of nurses, medical directors, primary care providers, specialists, and emergency room physicians, and are updated as the latest evidence-based research becomes available. And since 90% of nurse triage centers use the same standard guidelines, they have the experience and feedback to continue to make these standard of care in the nursing triage industry. So far, we've talked about the historical background, about how nurse triage has evolved, and about what protocols are and who designs them. But how does a typical nurse triage call center actually work? Nurse triage as a profession has evolved dramatically over the last 10 years. Prior to the widespread use of the Internet, nurses worked mainly in large call centers, and most patient encounters were faxed to them from outside sources, such as answering services. The nurses would use the information faxed to create a patient record, then call the patient back, perform a triage, and then fax the form back to the physician office. This process could be very slow and tedious at times. If staff called in sick or could not make it to work due to inclement weather conditions, then it might take hours to find a replacement nurse, which further slowed down the triage process. The development of better software and communication systems has allowed telephone triage nurses and managers to work remotely from home. These advances offer several advantages. We'll go over a few of them here. Firstly, patient encounters are entered directly into the software, which means the nurse has quicker access to the information. The new software is a more secure method for transmitting personal health information than the fax machine. Other advantages include a quicker callback time leading to increased patient satisfaction, and the ability for call centers to manage a higher call volume more efficiently by having nurses that can log on immediately with no commute time. Nurses also have more satisfaction. They can work from home, saving themselves the time and expense of commuting. Nurse triage is much more efficient today thanks to the advanced technology. Let's walk through the steps of a typical triage call. First, the patient makes the initial call to either their physician's office or calls the designated triage line number. An answering service enters the information directly into the triage software, where a nurse can claim the call and with the click of a button calls the patient back directly. Once the nurse gets the patient information, they talk with the caller, review their medical history, and their current symptoms. Taking all of this into consideration, the nurse will select the most appropriate protocol based on the caller's most urgent symptom. The protocol then leads the nurse through standardized questions which guide the caller to the most appropriate level of care based on the severity of their current symptoms. The dispositions can range from calling 911, going to the emergency room, visiting their doctor within 24 hours, down to giving home care advice to keep the patient at home safely. Once the patient and the nurse agree on a plan of action, the nurse will encourage the caller to call back for any other concerns, and she will close her encounter. The note is electronically faxed to the physician office, or in more advanced offices, the encounter is received via file transfer protocol or sent directly to the physician office's EMR, where it becomes part of the patient's permanent medical record. There are many features of advanced nurse triage software and systems, some of which include the ability to secure text the doctor when the nurse has to reach him, the development of smartphone apps for patients to request a callback directly from their phone. Direct integration with electronic medical records is available with most advanced nurse software systems, and the ability to view a brief medical history from the patient's medical chart within the software is also available. Sometimes the software has the ability for the nurse to make a patient appointment in the electronic medical record if they need to be seen the next day. This is a convenience for the patient as it saves them time and gives them peace of mind that they already have an appointment scheduled. Nurse triage call centers can also work to prevent hospital readmissions. They can do follow-up calls after patients are discharged from the hospital or after surgery. They can manage chronic diseases such as diabetes, asthma, and heart disease, and they can perform surveys or other functions that can be done over the telephone.
Nurse triage is seen in many different aspects of medicine today. It is used by hospital systems to increase referrals to their facilities and increase the community's awareness of events offered by the hospital. Insurance companies, including managed care and many Medicaid organizations, utilize nurse triage to assist their members in saving costs by making sure the patients are seeking care at the appropriate levels. Physician offices rely on nurses to triage their patients after hours. Health plans, physicians, and other healthcare providers involved in the telephone triage system report a variety of benefits from using nurse triage, including economic savings, saving costs by getting the patient to the right level of care at the right time. Patients having timely access to medical information and referrals leads to increased patient satisfaction. And let's not forget nurse triage also provides the physician with needed relief and peace of mind when their office is closed. In this video course, you have learned that while triage systems have been around for many years, it is only in the last 30 or so years that telephone triage has evolved dramatically from a system of mostly manual forms and nurses or other medical personnel winging it when giving advice to patients, to a system that uses highly specialized technology to assure that all patients are triaged using standardized algorithms and given accurate dispositions and care advice. We went over how using protocols gives the nurse a standardized and uniformed approach to assessing her patient and went over the basic steps a nurse takes to triage her patient. Congratulations on finishing this video course on protocols, what they are, and how they are used. Let's take a look at the pre-test questions. How did you do? Did any of your answers change based on the information you learned? Don't forget to come back soon for the next video course where we will explore more on protocols and how to be sure you are choosing the right one.
Don't forget to come back soon for the next video course where we will explore more on protocols and how to be sure you are choosing the right one for your patient's symptoms.